In the BLS procedure, when you find that the victim is not responding and not breathing, start CPR without any loss of time. CPR, Cardiopulmonary Resuscitation Procedure. It is the very first assistance given to a person who has collapsed and has stopped breathing. It attempts to restore circulation of the blood. It is an emergency procedure by which one can manually prevent brain damage due to lack of oxygen and preserve the life. It involves external chest compressions and breathing check.
Importance of CPR.
CPR is given because the vital organs must be supplied with enough oxygenated blood, else it may lead to serious consequences. While oxygenated blood is crucial for all vital organs in our body, the brain cannot afford to go without oxygenated blood for more than 6 minutes, which may lead to a coma and the brain cells starts getting deactivated. Providing CPR can help in continued blood supply to the brain and also maintain the liquid nature of blood. The CPR procedure needs to be in the order of the vital signs of life, which are circulation, airway, and breathing. The first vital to be taken care of is circulation, that involves performing chest compressions, which would ensure continued circulation of blood. When doing CPR, the best place for the victim is to be on any hard surface like flat on the floor.
Circulation. To keep the blood in motion, you need to give chest compressions to the victim. From the navel, move upwards until you find the V point. You can even locate the V point at the intersection of the ribs directly. From the V point, move 2 inches up. This is the center of the chest, underneath which the heart is located. Alternately, draw an imaginary line between the nipples, and at the center of the line is where the heart is located. Using your stronger arm, place the heel of your palm at this point. Place the other hand on top and lock the fingers. Keep your hip firm. Ensure that the compressing arm is straight. Begin compressions. One compression constitutes pressing down on the chest and allowing the chest to recoil back. Push at least 2 to 2.5 inches deep. Allow the chest to fully recoil to its normal position. Give compressions at the rate of at least 100 to 120 per minute. Time the compressions by counting aloud 1, 2, 3, 4, 5, 6 and so on till you complete 30 compressions. 30 compressions make 1 cycle of CPR. Give 5 continuous cycles. After each cycle, check for breathing. Providing chest compressions will move the blood throughout the body by contracting and expanding the heart. Clearing the airway. The second vital to take care of involves opening the airway. An open airway is vital for survival. In an unconscious victim, the airway being blocked is a regular suspect. The victim could have puked and particles could obstruct air from getting in, or it could just even be the victim's own tongue causing the obstruction. This can be cleared easily using the head tilt chin lift method as explained in Vitals. After providing 30 chest compressions, open the airway of the victim. Just clearing the airway could at times help air gush in and the victim could gasp for breath and revive. Breathing check. The third and final vital check involves checking for breathing by using the look, listen and feel method. If the victim is not breathing, start the next cycle of CPR compressions.
What we have learned so far is adult CPR. Now what if the victim is a child or an infant? Let us look at the international recommendations for that.
CPR on children. If the victim happens to be a child, perform CPR compressions with just one hand. To perform CPR on children from the age of 12 months until puberty, place the heel of your stronger arm at the center of the chest and push at least 2 inches deep. Allow recoil and give compressions at the rate of at least 100 to 120 per minute. 30 compressions make one cycle of CPR. CPR on infants. If the victim happens to be under 12 months of age, use just 2 fingers, index and middle finger. Place them at the center of the chest and begin compressions by pushing at least 1.5 inches deep and allow recoil. Give compressions at the rate of at least 100 to 120 per minute. 30 compressions make one cycle of CPR.
Let me put it all together for you. Locating the center of the chest, pressing at least 2 inches deep with 30 compressions at the rate of 100 to 120 per minute makes one cycle of CPR.
How many cycles of CPR should we give?
How many cycles of CPR should we give, you may wonder. Well, the international recommendation is to give 5 continuous cycles of CPR, at the end of which, if there is still no sign of recovery, continue further cycles.
When to stop giving CPR?
You can go on and on and on, but when would you really stop giving CPR? You should stop rendering CPR only in the following circumstances. 1. If you find that the victim is beginning to respond in whatever cycle of the CPR you are at. Or 2. Remember, you had called for an ambulance before providing CPR. You can stop the CPR if the ambulance has arrived. Or 3. If you are suffering from fatigue that you cannot continue further, you can stop CPR. Remember, if you are tired and no longer able to provide effective chest compressions, you can stop giving compressions. Meanwhile, you can call for help and give instructions to another person at the scene to start providing the CPR. At any cost, giving compressions should not be stopped because by stopping CPR, the victim may suffer brain damage and lose his or her life. Even if we are trained, sometimes doubt takes over and we may not be confident. It is always better to try to help a victim with no vitals than to do nothing at all. The difference between action and inaction could mean the difference between life and death for the victim. If you are not trained in CPR, or if you have received training but don't feel confident in your abilities, the apex bodies of the world, such as the American Heart Association, Indian Resuscitation Council, the Mayo Clinic, and all others, recommends simply doing chest compressions or hands-only CPR as it is called at the rate of 100 per minute until paramedics arrive. To put it simply, press as hard as you can and as fast as you can on the center of the chest. With the increasing occurrence of cardiac arrests reported world over, it is a need of the hour to learn this life-saving technique.
Chapter Summary.
In this chapter, you have learnt the importance of CPR, how to render CPR to adults, how to render CPR to children, how to render CPR to infants, and when to stop giving CPR.